guys, this video is about penis irritation or male urinary tract infection. What's this, guys?
Penis irritation, the male urinary tract infection. Break out the cranberry juice, boys, and gather round to learn about an infection most men think is only for the ladies, the urinary tract infection, UTI. But guess what? You too have a urinary tract, so it can get infected as well, causing you a lot of penis irritation. Although only a small percentage of men have to deal with this penis problem, it's still worth talking about because it can lead to more severe issues, like a kidney infection, or tip you off about an underlying issue, like an enlarged prostate. Let's learn a little about how men experience UTIs, how to deal with them, and, most importantly, how to prevent them from coming in the first place. Symptoms of a UTI. Talk about penis irritation. UTI symptoms are no joke. They are definitely things you can't ignore, and include a frequent, intense urge to urinate, although very little actually comes out. A burning sensation when you pee. Cloudy, dark, bloody, or strange-smelling urine. Fever or chills. Fatigue and drowsiness. Pain or pressure in the back or lower abdomen. Vomiting and nausea. Once you start feeling the pain in the back and lower abdomen or start vomiting, head to the emergency room, as your minor penis problem may have developed into a full-blown kidney infection. Dealing with UTIs. So, you get a UTI, what now? Unfortunately, there is a real gendered approach to OTC remedies for urinary tract infections. All of the packaging is female-focused, not only in branding but also in remedy type and instructions. This leaves men wondering how they can get rid of this penis irritation without having to head into the doctor. Well, sorry, bud, but you can't avoid it. Nearly every UTI caught by a man will require a trip to the doctor. This is not the sort of thing you can walk off. Expect to be asked for a urine sample and to get a genital exam. Be sure to mention if you think you contracted this penis problem from anal or oral sex, since they require different medications than other types of UTIs. Since it's more difficult for a man to get bacteria into his bladder, it is just as hard getting it out. Waiting for a UTI to clear up on its own will only make it worse. Unlike women, who will often receive either a single dose of antibiotics or, at most, 5 days' worth, men will be on a prolonged treatment schedule of around 7 to 14 days. Sorry, but dem's the brakes. When should men start worrying about UTIs? While a man can get a UTI at any age, the majority of UTIs happen to men age 50 or older, and it is usually due to an enlarged prostate. What happens, in this case, is that the prostate stops the bladder's ability to drain completely, inviting bacteria. Younger men usually get them from some sort of sexual activity, and men should be aware that UTIs caught by way of oral or anal sex can be hard to budge since they don't respond to the typical antibiotics most prescribed for UTIs. How to prevent UTIs? Here's the good news: only 12% of men will ever get a UTI in their lifetime. But to further prevent you from being one of the 12%, take some of the precautions below to keep your risk of contracting a UTI as low as possible. Always practice safe sex. Always urinate after sex or orgasm. Never follow anal sex with vaginal sex without a major cleanup on ILU. Don't have sex with a partner who has a UTI, since those infections are communicable. If you like this video, don't forget to like and subscribe. Thank you for watching.